The September 27th, 2021 regular Wasilla City Council meeting is called to order. The time is 6 p.m. Before we begin, council, please put away cell phones. If you have personal business to attend to during the meeting, please move for a recess. Also, when speaking, please remember to state your name for those streaming the meeting. Madam Clerk, please call the roll.
Thank you, Madam Mayor. Councilmember Rosa?
Here.
Councilmember Johnson?
Here.
Councilmember Burney?
Here.
Councilmember Vlock?
Here.
Councilmember Brown?
Here.
Councilmember Harvey?
Here.
You do have a quorum, Madam Mayor. We have Councilmembers Rosa, Burney, Vlock, and Brown participating with us in person. Councilmembers Johnson and Harvey are telephonic.
Thank you. Please stand for the Pledge of Allegiance, and Tim, would you lead us?
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For all.
Okay, approval of agenda. The first item of business is the approval of agenda. Are there any changes?
Madam Mayor, this is,
Yes, Mr. Johnson.
yes, I would like to hold a discussion, please, on AM 2144, please.
Okay, we will move it under new business. Are there any other changes?
Madam Mayor, Councilman Rousa.
Yes.
I have nothing to contribute to resolution serial number 2120. No questions or anything, but just as a matter of public record, I would like to just hear a brief narrative on it. And so I don't know if that's something that we need to pull it from the consent agenda to do, or if staff could just comment on that at some other time. Thank you.
Madam Mayor, if there may be discussion from the body, we should probably move it to new business. However, if there's not, and the body's just looking for a staff report, once I read the consent agenda into the record, we can ask Mr. Tankersley to give a report on the resolution. So it's really up to the body.
I would recommend we move it to new business.
Okay. Okay. Are there any other changes? Hearing none, is there a motion to accept the agenda as amended?
Madam Mayor, I move that we accept the agenda as amended.
Second?
The motion has been made by Councilman Brown, seconded by Councilmember Burney, and roll call vote, please.
Councilmember Rouse, excuse me, how do you vote on the approving the agenda as amended?
Yes.
Johnson?
Yes.
Burney?
Yes.
Vlock?
Yes.
Brown?
Yes.
Harvey?
Yes.
The motion passes unanimously, Madam Mayor.
Thank you. Special orders of the day is a proclamation recognizing October as Breast Cancer Awareness Month. The City of Wasilla proclamation recognizing October as Breast Cancer Awareness Month. Whereas breast cancer is the most commonly diagnosed cancer in women, according to Susan G. Komen Foundation, and whereas Breast Cancer Awareness Month is a worldwide annual campaign in October involving thousands of organizations to highlight the importance of breast cancer awareness education and research. Whereas, according to the Centers of Disease and Prevention, the CDC, breast cancer is the second most common cancer among women. And whereas increasing the public's knowledge about the importance of early detection of breast cancer diagnosis and treatment can save lives. And whereas Breast Cancer Awareness Month is an opportunity to unite all citizens in our community to prevent breast cancer deaths through increased education and regular screening. And whereas Approximately 125 new cases in every 100,000 Alaskans will be diagnosed with breast cancer this year. And whereas nearly 20 of every 100,000 Alaskans will lose their fight with breast cancer. And whereas it is important to continue the fight against breast cancer and to reduce the risk of this disease among our citizens. And whereas October 15th, 2021 is National Mammography Day, a day set aside to promote the importance of regular mammograph screenings in the early detection and prompt treatment of breast cancer. And whereas Wasilla women are encouraged to take preventive action, including performing monthly breast self-examination, getting regular clinical breast examinations, and following the American Cancer Society's guidelines for having a screening mammogram. Now, therefore, I, Glenda D. Ledford, Mayor of the City of Wasilla, do hereby proclaim October as Breast Cancer Awareness Month in the City of Wasilla and encourage all citizens to observe Breast Cancer Awareness Month through education and examination, dated this 27th day of September 2021. Okay. And we are on to, next on the agenda is Commission and Agencies Report. We'll begin with a report from Busines High School Student Representative. You could have a seat if you'd like, and please state your name. You don't have to. But you got to talk real loud.
Good evening, Mayor Ledford and City Council members.
My name is Connor.
And my name is Kiara.
Busines High School is going strong this year despite COVID. We currently have 245 students and up from 40 students from last year.
Esports just got underway last week and we look forward to upcoming tournaments. Esports is the only sport we have at BHS.
Our after-school program called LEAD is going to be showcased in After School Alliance National Newsletter. They are highlighting the growth after-school students have in both reading and math.
This week we are celebrating Student of the Month. Students are nominated by a teacher for displaying this month's habits of success. The habits for September are stress management and self-regulation.
Thank you for giving our school a voice.
Council, do you have any questions for them?
Madam Mayor, I've said this probably ever since I've been here, but I'm very proud of you guys, and I look forward to one day you guys being leaders of this community, and this is a very good start to come. It takes a lot of courage to sit up here, so keep up the great work, and I'm just really proud of the entire program, the entire school, and what's going on there, and I just want to give you guys encouragement just to keep up the great work. Pretty proud of you guys for being here. Thank you.
Okay, all right. Thank you so much. Up next is Matsu Health Foundation.
Hello, everybody, and thank you for having us. My name is Robin Menard, and I'm the Chief Communications Officer for the foundation. I'm co-presenting tonight with Karen Kahneman, who is our Vice President of Programs, and she's dialed in, so we're going to kind of go back and forth, but I'm going to kick things off, if that sounds good. We were asked to come update the council on our COVID-19 response, and mask off, okay. And so that's what I'm here to do tonight for you all. But first, I want to start with just who the Matsu Health Foundation is. I know some of you know this story, but some of you don't. So just very briefly, Matsu Health Foundation is actually, our technical name is Valley Hospital Association. We do business as Matsu Health Foundation, but we were the original Valley Hospital back in Palmer before Matsu Regional Medical Center was built. And what happened 25, 30 years ago now, when the population started exploding here, we needed a new hospital badly to serve our growing healthcare needs. But as a nonprofit hospital, there was no money to do that. So Valley Hospital Association entered into a partnership with a for-profit hospital company, and that's how Mat-Su Regional was built. One thing that's really different, it happens all the time that nonprofit hospitals sell out to for-profits now, but luckily our leadership at the time had the foresight not to sell out completely. We retained partial ownership. At this time we own 30% of the hospital, and that means that 30% of the profit at Mat-Su Regional stays right here in the community because the foundation has it. And as you know, we grant it out and do all kinds of programs with that money. So in addition to retaining the ownership, partial ownership, the other really brilliant thing is we get to seat half the operating board. So the foundation seats half the board to make sure that the community's needs are being met. So that's how Mat-Su Health Foundation came about. And I'm going to show you this little diagram. Oops. It's actually kind of hard to see here. We call it our way of working in the world. It's our theory of change. And basically, in a nutshell here, we're very epidemiologically driven, which means we address root causes of mortality and morbidity, and we work off solid data and analysis. And we're going to talk in a little bit about some of the reports that we've produced. But everything we do is driven by data. And it's also very community driven. We want to work where the community is ready to engage. So we don't want to lead the community. We want to be there to support the community and to build capacity for other leaders to do the work that needs to be done. And we work a lot at the policy and advocacy level, more and more so over the last several years, of just being involved in what kind of policy and regulation change needs to happen to achieve our mission for Mat-Su to be the healthiest borough in Alaska. We focus on building out the continuum of care in our focus areas, which Karen's going to talk about shortly, improving systems and care coordination, and frankly, making sure that state systems and funding frameworks treat Mat-Su equitably. All the time, they lump us in with Anchorage, and we don't get our fair share of funding in Mat-Su, and we work really hard here with state legislators to make sure that Mat-Su gets its fair share of funding. Now I want to turn things over to Karen, and she's, like I said, Vice President of Programs. She runs what we call the philanthropy part of the business, and she's going to talk about starting with our focus areas. So take it away, Karen.
Great. Thank you, Robin. And Madam Mayor, I just want to confirm that you can hear me okay before I keep going.
Yes, we can hear you.
Great. Thank you. Well, good evening, all. And as Robin said, I'm going to give you a little bit of an overview of our philanthropic work, and then to dive into some of our unique programs that we've developed based on the pandemic. So where we work, or what we're working on, we have 5 different focus areas that we put our attention to and allocate resources toward. Those include healthy aging, as I'm guessing many of you know that the Mat-Su has the highest or the fastest growing senior population in the state. And one of the main goals of that healthy aging program is to ensure that older adults and those with disabilities are able to age in place in our community. Our next focus area is healthy minds. This was one of the top 5 issues that was addressed in our community health needs assessment that was done a few years ago. And the goal of this focus area is to really have a complete and effective behavioral health continuum of care within the Mat-Su. Healthy families is our third focus area, and this was the #1 community goal in our community health needs assessment. And the goal of this program is to ensure that we have safe, healthy, and thriving children and families in our community. The next focus area is healthy futures, which is really building a pipeline of health and human service workers for Mat-Su. And the last focus area is healthy foundations. And this is really looking at the core areas of things people need to survive, and those factors that affect how we live, work, and play in the community. Things like transportation, healthy food access, housing affordability, safety. We have designated program officers that are assigned to each of the focus areas and can help anyone in the community to learn more about the grant-making process. In addition to our focus areas, we do spend a quite sizable amount of time and resource toward really looking at commissioning different kinds of reports to better understand the health of our community. And then that helps us to better understand where to allocate resources. And so, as Robin said, we really do take an epidemiological approach to our work. And we do things like pay for increased sample sizes for state-level health research to make sure the MATSU information is more statistically accurate. We developed a health data repository on our website that anyone, including local nonprofits, can use for grant writing and program development. And we really try to study the problems that we want to address. So we interview people that are impacted by a health challenge. We provide, we interview folks that are providing the services. We look at all the data collected by the state, and we also conduct our own surveys and data collection. We analyze the data usually with an immense amount of help from others, and we include system-level recommendations, programmatic recommendations, and policy recommendations in response to the data, and then we try to implement those. These reports become our playbook in creating impact, and all of the reports can be found on our website if folks are interested in seeing more about those. It's nice to talk about the work that we've been doing pre-pandemic, but I'm going to shift a little bit to the work that we've been doing in relation to COVID-19 and the response that the Health Foundation has had in really trying to address the concerns of the community. Typically, we focus on the long game, being patient and moving systems forward to benefit MAPC residents. However, the crisis really demanded us to move more quickly, get the dollars out the door faster, and to address more short-term basic needs and coordination. And there were 3 grant programs that we launched based on the pandemic. And I'll go through those in a little bit more detail. But the coronavirus prevention and response, also known as the CPR grants, community-driven C-19 response funding, and community-19 behavioral health recovery grants. The first, the coronavirus prevention and response CPR grants, were announced in March of 2020. This was really to, again, address some immediate concerns happening during the pandemic. To date, we've awarded more than 50 grants, totaling more than $1.8 million to local nonprofits that are meeting critical safety needs, including housing, transportation, child care, behavioral health support, and food security for those affected by the pandemic. We also were able to partner with the United Way of MAPC to coordinate food distribution and transportation related to COVID-19. And over 40 providers met weekly in the early days of the pandemic to address the critical needs due to the virus. Examples of some of the Wasilla area organizations that have received CPR funding include Valley Charities, Frontline Mission, True North Recovery, Kids Covered, My House, and Set Free Alaska. We are still awarding these grants, so community organizations can still apply for them. Really looking at organizations that we can provide funding for supplies, equipment, other programmatic costs that organizations might have, trying to minimize exposure for high-risk groups while meeting their basic needs. Also, organizations that are working to secure basic needs for all residents, like food banks for homeless prevention programs, organizations that are providing child care and early learning services, and organizations that are supporting social connections and positive support for activities for youth. So that's the first one. The second one is community-driven C-19 response funding, and this was launched in August of 2021, and it's a partnership with the City of Wasilla, the City of Houston, the City of Palmer, as well as the Mat-Su Borough. And these were funds that were that came from the federal government through the Department of Health and Human Services, $5.1 million, and we took on the administrative process of distributing these dollars out into the community, and that's been a really wonderful partnership, and the dollars are honestly just really already going out the door. And we've seen proposals received for expanding of mobile testing, including expanding testing in non-traditional facilities in Talkeetna, adding mobile testing for the core and outlying areas, including a school district mobile testing strike team, We've received proposals for vaccines and vaccine information, including proposals to do a vaccine event at the state fair. We have supported that COVID call line. Federally qualified health centers have asked for dollars to support expanding testing and vaccine capacity and monoclonal antibody treatment. We've had faith-based information and outreach. We've had communications and outreach done by the Health Foundation on vaccines testing and COVID information. We've also supported or had proposals to support health equity and recovery and prevention specific to COVID, including health air filters for locations like classrooms and congregate settings where vulnerable folks might be coming together, a COVID coordinator for a preschool program, modifications for facilities providing temporary housing, quarantine facilities, and food delivery modifications to prevent the spread of COVID, and COVID mitigation in other facilities. So that's our second funding stream, and we are still accepting applications for that right now. And then our third funding stream was based on a report that was commissioned in May, which was a report looking at the behavioral health of frontline workers in relation to COVID. So really zeroing in on folks that were part of the essential services during and still during the pandemic at that time, and really looking at the impacts of COVID-19 on behavioral health for them. And it was really an enlightening report, and it can be found on our website as well. And what we learned was that frontline workers have just faced an inordinate amount of stress on all fronts, but they haven't been able to utilize their usual self-care and protective practices that might mitigate for that stress, including connecting with family and friends, gathering for celebrations, an inability to have like cultural and ritual grieving and grieving practices like funerals or celebratory practices like weddings. Many frontline workers were stressed about not feeling financially secure. The workers were also concerned about many of the same issues that have been reported in national studies, including fear of being infected with COVID-19, the stress of shortages of personal protective equipment, stresses related to taking on new roles at work, disagreements with others over the risk of disease, and constantly changing pandemic guidelines. And unfortunately, we've just seen the mental health stress on frontline workers perpetuated, and there are many frontline workers, in particular healthcare workers, that are just almost in a crisis mode because they've just been dealing with this chronic stress for such a long time. There were over 400 frontline workers that contributed to this study. There was an online survey of 358 people. 32 managers and directors of organizations also participated in interviews, and there are also 4 workers that were interviewed with 10 people each. So it was a pretty robust study in which we learned a lot, and the community learned a lot. And just to go back to what we consider a frontline worker, those were defined as folks that were working in behavioral health, child welfare, domestic violence, sexual assault, early learning and child care, emergency services, social supports, youth residence programs, and education. And finally, with the COVID-19 behavioral health recovery grants, we accept applications for anyone who is applying if they can base their program on that report. So they link it back to the report, and that really allows us to see that they're addressing the needs that emerged out of that report. And so that can include everything from self-care, healing, and cultural activities for workers. It can include resources that might help to prevent and identify worker burnout, compassion fatigue, and vicarious trauma. It can address issues of systemic issues where frontline workers might have access to behavioral health support and support that might identify and fund behavioral health services for those folks. And so we're, again, still accepting applications for this grant process, and they'll be accepted through 2021 until our funding runs out. And I know Robin will give you our contact information if anyone's interested in finding out more about those and applying for them if you're out in the community. So thank you for your time tonight, and back to you, Robin.
All right, thank you, Karen. Oops. One thing, I didn't have this in the presentation yet because we just did it today, but we are partnering with the borough and tomorrow overnighting a check to pay for 25,000 home test kits for COVID that will be distributed at no charge to Mat-Su residents. So with the hope that people, if we make it easier to get a test, they can do it at home, they can have privacy because some people don't want to go get tested and be in the system, and then hopefully if they get a positive test, they'll contact a healthcare professional and stay home and instead of being out in the community. So those are going to be shipped the middle of October, and as I indicated, we're working with the borough to figure out distribution through places like food banks, social services agencies, the cities if they want to participate, the libraries, just anywhere where people are. We're going to try and get those test kits out into the hands of folks to supplement all of the other testing that we're supporting. And that was part of that community-driven C-19 funding that came to us through the city, all the cities, the borough, and ultimately the CDC. So I do want to mention we also started this COVID information line. Connect Mat-Su is part of the Mat-Su Health Foundation, and it existed pre-COVID. It's a line where people can call if they need assistance and they don't know where to call. And they get, you know, like not quite, it's like casework light, we call it, but if someone calls and says, I can't feed my kids, what should I do? Or I can't find a doctor that takes Medicare, or I can't get transportation to get to work, the staff at Connect Mat-Su, which is located in our building sort of across the street over there, will help them find the resources they need. We have a very robust database with thousands of entries and do a warm handoff to help folks out. When COVID happened, we entered into a partnership with the Primary Care Association, and now we have additional operators that are also on contract from this C-19 funding to help people. Who do I talk to about whether or not I should get a vaccine? Where can I go to get tested? How do I take care of my loved one when they have COVID? Any sort of COVID questions. So the phone number's up there. They're staffed weekdays from 8 to 5 and just trained operators that are healthcare professionals to help folks with COVID questions. And then finally, you may have seen, we've done a lot of public information campaigns, advertising campaigns. Some of these that you see here are from very early on. Just none of us knew what was going to happen back in March of 2020, remember? When we were telling people clean surfaces and wash your hands, and those things are real super important. But now we've learned the importance of wearing masks and considering vaccination. And then Dr. Quimby from Mat-Su Regional Medical Center did a very compelling series of ads for us, and we're getting ready to do more because we did some oversampling. The university did some research, particularly in Mat-Su, of why there's so much vaccine hesitancy, and what we learned is that people are most likely to listen to a healthcare provider and their friends and neighbors. So we sort of moved away from using public officials and into using medical professions to try and deliver those messages of keeping people safe. And that is the end of our formal presentation, but Karen and I would be happy to answer any questions. And also, here's our contact info if you have something you want to follow up on later.
Okay. Council, do you have any questions?
Madam Mayor.
Mr. Burney.
Well, I'm glad to hear there's test kits going out because that line loops around the old Sears building for maybe 2 or 3 times
Sometimes.
or so. Of course, it's the Mat-Su Borough. There's a lot of independent-minded people up here, myself being one of them. We've seen just as much research against the vaccine as we have for the vaccine, which to me they both seem legitimate. I'm on one side, of course I have friends on the other side. I begrudge nobody who wants to get the vaccine. Is there anybody within this program to be able to, you know, kind of dovetail it all together to you know, kind of not sway, but maybe just have the conversation about the pros, the cons, Because I think there's experts on both sides that have good points on both sides, and there's a lot of questions out there, especially for those people that are on the fence for the vaccine, specifically the vaccine.
There are a lot of questions, and what we've decided to do at the foundation with our internal operations is follow CDC guidance, because you can go on the internet and read 50 articles and learn 50 different things. And so what we would do with Connect Mat-Su, for instance, is refer people to others. We're not the experts. I'm not a scientist. I'm not going to be able to tell you whether or not to get vaccinated, but I will try and help you get access to information so you can make a decision.
Okay. So this would be a good number to point people.
Yes, for sure. Yeah.
A good place to start.
Definitely.
Okay.
Yeah, to Connect Mat-Su, and then when you call, it'll say if you're interested in COVID information, press 2, and that'll take you to those specially trained people that are with the Primary Care Association.
Sure. Okay. Thank you very much.
You're welcome.
To the mayor, Councilman Rousa. So these grants, Coronavirus Prevention and Response Grant, Community-Driven C-19 Response Funding, and COVID-19 Behavioral Health Recovery Grants. What's the source of funding for these grants? Is it federally funded, state funded? What's the mix there?
It is a mix, and Karen, would you like to take that one? Or do you want me to do
it? I can jump in, and Robin, if you want to, yeah, I'll start. So yes, it is a mix. The Corona Prevention and Response Grants, so CPR grants are traditional foundation dollars. So those are the dollars that Robin mentioned are partly part of the profit from the regional hospital. For the community-driven C-19 response funding, that's a unique funding stream that actually, the original dollars from the CDC, they flow to the Department of Health and Human Services, and we worked with the cities and with the borough to actually administer those funds. So traditionally, those funds would have come through jurisdictions in a community, but we worked collaboratively with the jurisdictions to actually have those dollars come through the foundation and administered through the foundation. So they are unique dollars that are coming from the federal government to the state government and then to the local community. And then the final one, the COVID-19 Behavioral Health Recovery Grants, those are our traditional foundation dollars as well. So those are similar, or the same as the CPR grants.
Thank you. And through the mayor, Councilman Rouse, I have one more question, and this one might be a little bit more complicated, but wanted to ask it anyway. There are people that have chronic illnesses and health issues that they've dealt with for years. There's people that develop new health issues that are unrelated to COVID, and I know that there's kind of at least a perceived issue of people not getting care either because A, they don't want to go to the hospital because of COVID, or B, they go to the hospital and they just don't receive the care because of COVID, again, because the attention is given to COVID. So as a person that has type 1 diabetes, as a person who has, had family members with other chronic illnesses and things, knowing a few people that rely on dialysis to stay alive, what efforts are being made to reach out to people to make the hospitals approachable in a COVID environment, in a COVID-rich environment where a lot of people know for sure that if COVID, is anywhere, it's at the hospital? Thank you.
That's an interesting question that honestly would probably be best answered by the hospital or by other medical providers, but I can tell you that the hospitals, I look at the dashboard daily for Mat-Su Regional, and they have 14 ICU beds. They're almost always completely full, and a lot of those are COVID patients. And so we've just really worked hard to encourage COVID mitigation, which would include, again, hand washing, masking, considering vaccination, keeping distance like we are, because the hospitals, the stress on the healthcare workers is very real, and it's very overwhelming. And it would be, I mean, we know that we've heard anecdotally that people are delaying care for other issues because they don't want to be in a COVID-rich environment. So it's a really good concern.
Thank you. And so is it fair to say that maybe it's not being responded to, or is that kind of what you're saying there?
That's not what I intended to say. What I intended to say was if you have a question about what the hospital is doing to encourage people to still get care, that would be a better question for the hospital.
Thank you.
Okay, is there any other questions? Hearing none? Thank you, Robin. We appreciate you coming and sharing with us.
You're welcome. Thank you very much for your time.
Okay, there are no public hearings this evening, so we'll move on to persons to be heard. And Mr. Stearns.
Good evening. My name is Tom Stearns. I'm the Senior Ambassador for the Wasilla Area Seniors Incorporated. We have the Willow Project is fast being completed. The move-in date will be sometime at the end of October or beginning of September, November, and the ribbon cutting will be on 4 November at 1:30 in the afternoon. Then you all have this. It's the Pie It Forward for 2021. And we did a great job last year, which was the initial year of this, as a fundraiser, not knowing what we would be able to do. This year we do know a lot better. And so what we're doing, we're starting now to get our sponsors. So as you can see, we have 5 levels of sponsors, and then we need the sponsors. We need people that will make donations, and then we need people to purchase the pies. And so people will purchase the pies, and they will pick them up and give them to people, and everybody will be happy. But we have something new this year. We are going to, the auction earlier in the year was so successful, we're going to do it again. And so we're going to have a new crop of stuff to auction off. And I might add, if you are into pictures, you might want to check those out. Some of the pictures that were in the auction earlier this year sold for pennies on the dollar. Really good, nice pictures were very cheap. All right, so then the 12th of October, key date. We would like to invite you all to come to our annual business meeting. This is the 1 year that you get to see everything that's going on with WASI. Plus, we've got 4 openings. So we've got 4, we're going to have 4 new board members. Now, one is coming up for a re-election, but the other one, the other 3 are going to be newbies. And so please come to that. We'd like your support there. And then the last thing is that the search for a new WASI CEO is over. We have a new CEO. His name is James Drayton, and he seems to be an energetic, excited, a young fellow that is going to lead us on to the future. And so I think he'll be a good fit for WASI. Thank you very much. Any questions?
Madam Mayor, what time is the 12th of October?
12:45. 12:45.
Will there be key lime pie? Just asking for a friend.
For the Pie It Forward. Oh, there'll be all sorts of pies. Probably there'll be a key lime pie. If you want, you can call them and tell them, give them your order. Anybody else? All right, thank you.
Thank you, Mr. Stearns. Is there anyone else who would like to address the council at this time? Okay. Madam Clerk, please read the consent agenda.
Thank you, Madam Mayor. We have approval of the regular meeting minutes of September 13th, 2021. We have one introduction with a public hearing date of October 11th, 2021. That's ordinance serial number 2116, amending the fiscal year 2022 budget by appropriating $74,904 in Federal Aviation Administration grant funding for the Wasilla Municipal Airport pavement maintenance project. And our only other item on the consent agenda is AM number 2143, contract award to Bob's Services LLC in the amount of $43,360 for a 2,500-gallon skid-mounted water tank for Henderson dump body installation.
Okay, thank you.
Madam, I'd like to move the consent agenda.
Is there a second?
Councilmember Velox, second.
Councilmember Burney has made the motion. Councilmember Velock has seconded. Madam, is there any more discussion?
Madam Mayor, Councilman Ralsa, if I recall correctly, and I'm thinking maybe I'm not recalling correctly, did somebody move 2116 from the consent agenda?
No.
Okay.
Madam Mayor, if I may. So that's just up for introduction. The two items that were moved were the resolution, 2128, your request, and then AM number 2144 at the request of Councilmember Johnson.
Thank you.
Okay, roll call vote, please.
This is on the adoption then of consent agenda. Councilmember Johnson, how do you vote? Mr. Johnson?
Oh, there, I'm off mute. Yes.
Thank you. Councilmember Burney?
Yes.
Velock?
Yes.
Brown?
Yes.
Harvey?
Yes.
And Rasa.
Yes.
The motion to approve the consent agenda passes unanimously with Councilmembers Rasa, Johnson, Burney, Velock, Brown, and Harvey in support.
Thank you. There is no unfinished business, and under new business, 10.1, the update from administration on emergency.
Tim Johnson.
Has left.
10.1, there's no, he did. So there is no new updates on the emergency response for COVID-19. Madam Clerk, would you please read the resolutions?
You bet. Thank you, Madam Mayor. We'll start with our next item of business is resolution serial number 2120, authorizing the city to participate in Alaska opioid.
Has joined.
Okay. Mr. Rausa?
Thank you, Madam Mayor, Councilman Rausa. I just was hoping to hear staff's comments on this.
Point of order. Sorry, I'm sorry. We need a motion.
Sorry.
Oh,
Sorry about
thank
that.
you.
Okay, I need a motion.
Madam Mayor, Councilman Rausa, I move to approve resolution serial number 2120.
Second.
Okay, the motion has been made by Councilmember Rausa and seconded by Councilmember Burney. Is there any further discussion?
Thank you, Madam Mayor and Mr. Burney, Councilman Rausa. Just, again, hoping to just hear staff's comments on this. I don't have anything to contribute directly. Thank you.
Okay, Deputy Administrator.
Thank you. We were at the Alaska Municipal League Conference in Fairbanks when this came across our desk. The City of Wasilla's is part of a settlement agreement with Johnson & Johnson and 3 other pharmaceutical distributors specific to the opioid crisis that we've had. There's 8 political subdivisions that are part of this case, and the funds that will be paid out are over an 18-year period. Primarily, those funds are going to be used for any kind of abatement activities or remediation activities that were part of the opioid crisis. They have not had all the details, but a 586-page settlement document came out just a few days ago that's being reviewed by AML. The city of Wasilla is estimated to receive somewhere between $70,000 and $80,000 annually, and they're expecting that those first payments would be around March of 2020. So this just gives us a avenue for receiving those funds, and then we would have to seek out partners. As you see in this resolution, it's Anchorage, City of Fairbanks, Fairbanks North Star Borough, Juneau, Kenai Peninsula Borough, Ketchikan, Kodiak Island Borough, Mat-Su Borough, and the City of Wasilla. And the idea is the municipal league would be that conduit to bring us all under one establishment instead of each of us individually receiving those payments. And so we're ironing out the details. Troy, did you want to say anything else?
Yep, just talk out. We're coming, hold tight.
Madam Mayor, I really don't have anything other to add. I think some key points was the amount, the 18-year period, and the fact that we don't have the picture of the opioid abatement and what's that. Deputy Administrator just described a 500-page document, takes a while to get through. The key is, too, that these municipalities are trying to come under one roof, because if we pair off individually, these settlements are going to get changed. And so I think it's a key important factor that these 8 municipalities work together so that we can get as much funding through these settlements, not just this settlement, but any other future settlement that comes through, and allows us to participate in those. So.
Thank you. Through the mayor to staff, I didn't have a question specifically, but I do now. So, Councilman Rausa, just a question on, so if I understand this correctly, this is funding for municipalities to deal with the maybe loosely regulated prescription opioids that we had in the past. And so this funding is to deal with the outfall potentially. So my question is, like, how does the city of Wasilla do that? We don't manage our health care. We don't, and it's interesting, Mat-Su Health Foundation is here. So I'm curious, what's that picture look like? How does the city of Wasilla use that responsibly to deal with the actual outfall of this issue where the settlement was reached?
Madam Mayor, Councilman Rausa, that is a very good question, and you are 100% right. This is not our expertise, right? So we absolutely have to come under an agreement. Typically, it's through a memorandum of agreement, similar to what we did with Mat-Su Health, through that granting pass-through that happened, that federal funding grant pass-through. It would be an arrangement similar to that a nonprofit or organization that deals with that issue or whatever issue that we're targeting, that's the agreement we would be going after.
Thank you.
Is there any further discussion? Hearing none, roll call vote. Madam Clerk.
Thank you, Madam Mayor. Councilmember Burney, how do you vote on the adoption of resolution serial number 2120?
Yes.
Councilmember Vlock?
Yes.
Councilmember Brown?
Yes.
Councilmember Harvey?
Yes.
Councilmember Rausa?
Yes.
Councilmember Johnson?
Yes.
The motion to adopt resolution serial number 2120 passes unanimously with Councilmembers Rausa, Johnson, Burney, Vlock, Brown, and Harvey in support.
Okay, thank you. Would you read the second AM, please?
Thank you, ma'am. That's AM number 2144, contract award to Alaska Permanent Capital Management Company in the amount of $45,000 for investment management services.
Do I hear a motion?
I move AM number 2144 for consideration.
Is there a second?
Councilmember Velock, I second that.
Councilmember Burney made the motion, Councilmember Velock seconded, and we are discussing. We're on for discussion.
This is Councilmember Johnson. I had asked that this be pulled from the consent agenda to a discussion agenda. The reason that I asked this is that this is asking for a sum of $45,000 for investment management services. The problem that I've got with this is in the contract itself. On page 26, it says that the work described, the statement of work as to what these people are going to do with us, is contained within attachment A. Attachment A is not in the package. At the current time, I have no idea what this funding is really for and what these people are going to do for us. If I could get a description of the work, I would really appreciate it. Thank you.
Mayor to Councilman Johnson, so I received your request and unfortunately didn't receive it in time to get into the contract files to be able to provide that document, which is the request for proposal that was done by Finance 4 years ago, I believe now, because this is the final year of this contract. This is typical contract language that we put in the contract that references both the RFP, any resolutions in the past, as well as the original proposal provided by, in this case, Alaska Permanent Capital Management. Alaska Permanent Capital Management, we solicited an RFP. They responded to that RFP 4 years ago. This resolution extends the contract one more year for the fifth and final period before we go out to RFP again. Alaska Permanent Capital is our external investment advisors. They are actively managing currently a $25 million portfolio. Through communication with me as finance director, they actively manage. I don't tell them what to buy and when to sell and whatnot. However, they do have to stay inside the confines of our code and our investment policy, to which they do. The price that they're paying, the price that the city pays, is for them to actively manage. And it's typically based on about 15 basis points of the active portfolio, in this case 25 million, which runs about a little over $3,000 a month right now. As we have excess cash that we can provide for more working capital, if it deems fitting, we'll transfer that over to the external investment pool for further investment. Does that answer your question, or is there more that I can elaborate on?
No, that answers it just fine. My concern is that in the summary statement is that there really isn't any explanation as to what the funds are going to be used for, other than the fact that they are a contract extension, which is really great, but it doesn't tell me what it's extending to. Now, your statement there was excellent. Had you put that into the summary statement in your proposal, we wouldn't be having the discussion. Thank you.
Is there further discussion? Hearing none, Madam Clerk, roll call vote.
Thank you. This then is the on AM number 2144. Councilmember Velock, how do you vote?
Yes.
Councilmember Brown?
Yes.
Councilmember Harvey?
Yes.
Councilmember Rausa?
Yes.
Councilmember Johnson?
Yes.
Councilmember Burney?
Yes.
The motion to approve AM number 2144 passes unanimously with Councilmembers Rousa, Johnson, Burney, Velock, Brown, and Harvey in support.
Okay. We are moving on to communications. Madam Clerk?
Thank you. Items for informational purposes this evening. First is IM number 2111, monthly financial reports for the period ending July 31st, 2021, to include the month-to-date expenditure report and disbursements greater than $10,000. We also have the Parks and Recreation Commission meeting minutes from September 8th, 2021.
Thank you. We are to audience comments. You have 3 minutes. Is there anyone in the audience that would like to speak to the council? Please state your name.
Hi, my name is Antonia Hagan, and I've just relocated again from Juneau. I was there for the last year. I left here to go be by my older children in Juneau, and it was a pretty neat experience. The city assembly, they had mask mandates, and they closed the city down for the entire time. And I've got a medical mask exemption, so I had to jump through whatever hoop it was required. But we weren't allowed to go into our Capitol building because they closed everything down. And so basically the city and borough of Juneau has been running our entire state. And with I was in contact with people, and just prior to coming here, there was still no mask mandates, and I was pretty excited about that because it's pretty challenging for everybody. And I want to caution you guys, because I'm not sure, CDC is really giving us the accurate information. There's a lot of facts out there that are flying, not just on the internet. And I just want to caution you guys. I know it takes a lot to get up here and do your job. It also takes a lot to get up here and talk. But I just want to ask you guys to do the right thing when it comes to making decisions for the rest of the people in this community. And maybe we should not be listening to the CDC anymore. And we should also look at the severity of the crimes against humanity that are taking place with the vaccines. And the latest numbers coming out on the VAERS website, I just watched I don't know what they call the meeting, where they were being reported to the FDA. The numbers on the VAERS for the vaccine adverse reactions are skyrocketed hugely, and it's not COVID. They've still never isolated the virus. It's never been isolated. So, as far as I'm concerned, it's all a lie, and I really want to caution you guys. You guys have a really important role in the welfare of this community, and I love it here, and I love the people here, and that's why I continue to come back here. So I just want to thank you guys for everything you do, and I don't want to ruffle feathers, but I can't be quiet anymore because people in Alaska are dying from vaccines. And I'm not about to put masks on my children, or my child. I've got adult children, and they can make their own decisions. But, yeah. You can get any information you want. My name's Antonia Hagan. My number's 907-500-5008. Thank you.
Thank you. Is there anyone else that would like to speak to the council at this time? Hearing none, we are on to council comments. Mr. Rousa, we'll start with you.
Get out there and vote. So that's it. I don't know if this is my last meeting or my first meeting, but we'll see. So yeah, thank you everybody for your kindness and your patience and everything. Just in case you don't see me sitting here next time around. So thank you.
Mr. Brown.
Welcome back, Madam Mayor.
Thank you.
And for those who have not been, I encourage you to take especially your young kids over to behind the fire station and look at the Patriot Wall we have there with the Declaration of Independence, the Bill of Rights, and the Constitution. It was an outstanding ceremony, and sorry you couldn't be there. But I think it's very educational. You hear about these things, but to see them and read them, I think will have a different effect on you and stuff. So thanks to the City of Wasilla for participating in that.
Okay, thank you, sir. Mr. Burney.
I would like to thank Ms. Hagan for coming out. I think there's many people out there that share your viewpoint and have done their research and done their homework, and there's a lot of people that share your viewpoint. And I think there's a lot of misinformation, and I think more people need to do their homework and not just follow the herd through the line. It's getting very divided and very frustrated, and I just wish everybody would be just a little bit more educated on what they're putting into their body. Having said that, I think we still have one more meeting, and hopefully many more for you. Yep, and congratulations. I haven't got to see you, so I think putting the bird on is a big deal, and congratulations, Mr. Brown, on that. And Madam Mayor, thank you very much.
Ms. Vilak.
I wanted to encourage everyone to get out and vote, and good luck to Jordan. And I do want to thank Ms. Hagan for speaking with us tonight. That does take some bravery to go against the herd there. And welcome back, Madam Mayor.
Thank you. Mr. Harvey.
No comments this evening, thank you.
Mr. Johnson. Yeah.
You just can't find the mute button.
Mr. Johnson. Okay.
Try it again, this time without mute.
Okay.
Yeah, I'm muted. You just don't like my coughing. So I want to welcome back, Mayor. I'm looking forward to joining you again in a couple of weeks. My wife and I are doing pretty good post-COVID now, and ready to return back to society. So thank you very much.
Thank you, and I'm glad you're getting better. Okay, first off, Ms. Vilak, I would like to thank you for stepping in for me the other night on such a short notice. You did a wonderful job. Thank you. Mr. Brown, let me tell you, I was at home and I was watching the presentation live on Facebook Live, and I couldn't have been more prouder of the city of Wasilla, how everybody came together and stepped up, and my head was this big. I'm like, oh my goodness, we really dressed up and put our best foot forward. And thank you from the bottom of my heart for taking over and doing a wonderful job. Crystal, thank you for stepping in. And congratulations. Yeah, I know. No. Just so you know. They wouldn't allow me to pay you. Okay. I'll take you right on my private plane. Anyway, but yes, I was so absolutely thrilled with that. And to go over there and see, because even before 17 and 76, people have been given their lives for those 3 documents. Think about that. And Wasilla put them in an exceptional place. It's in the Armed Forces Memorial Garden. What better place to put these? So please, everybody, take your family, take your friends out to see this. So with that, thank you all very much. Please stay safe. Anybody that gets COVID, go and get the antibodies. You'll be better in 24 hours, I'm telling you. So with that, we are done at 7:04.
So next meeting.